Hello and welcome everyone to this lecture on the 1918 flu, also known as the Spanish influenza. Although the first cases of the pandemic wouldn't be documented until early 1918, the story of the 1918 flu began in early 1917 when the United States began deploying troops to join the fight in the First World War. At this time, troops were being crowded into ships and trains and sent all over the world from all over the world, as well as being housed in the close quarters of military camps. It is perhaps no surprise then that the first well-documented cases from the start of the first wave of the flu were from Fort Riley in Kansas. Later in the year, a second wave, which was particularly virulent and infectious, cropped up simultaneously in many places around the world and affected both troops and civilians alike. This was followed by a third wave that ended with the last cases of the disease in early 1919. The death toll for this pandemic is estimated to be about 50 million people worldwide. At the time of the pandemic, the medical community believed the disease to be caused by a bacteria known as Pemphigus bacillus, which is now known to cause Haemophilus influenza. This bacteria was first found in the sputum of influenza sufferers in 1892 and so proposed to be the cause of the disease. However, this explanation was never fully accepted by the medical community as the bacteria was not found in all patients and was also the cause of more mild diseases such as ear infections. The true cause of the pandemic wasn't understood until 1997 when a team of researchers sequenced the genome of the disease, which was rescued from the preserved lung tissues of cadavers from the time. The culprit was revealed to be a strain of the human influenza virus, specifically a variant of strain A, which is responsible for causing the most severe forms of flu. The influenza virus is zoonotic, able to spread between humans and animals, and it is likely that the strain present in 1918 mutated from either a swine or avian source, resulting in what is known as a novel or new strain. It is also important to note that the influenza virus was not the only disease at play during this pandemic. In the impacted lung tissue of influenza patients, a bacterial pneumonia took advantage and was responsible for many of the deaths during this time. It is also likely that the disease underwent a second mutation between the first and second wave, as the second wave was documented as being more virulent and infectious than the first. While our understanding of the cause of the disease has changed, the symptoms associated with influenza have not altered much in the last 100 years. When the first cases came to the attention of a doctor at Fort Riley, it was noted that the symptoms of the men appeared unusual, but that the patterns of sickness appeared to indicate influenza, which was even then a seasonal and not uncommon ailment. Patients showed signs of unremarkable fevers, muscle aches, and occasional abdominal pain or headaches. In some, but not all cases, pneumonia followed, and deaths were often a result of the comorbidity. In more severe cases later on, blue-tinged skin, known as rapid cyanosis, could occur due to the patient's inability to get enough oxygen through the affected lung tissue. In most cases, the disease ran its course in 24 to 48 hours. A unique feature of the 1918 flu was the age categories it impacted. While most incidences of influenza cause increased mortality in infants and the elderly, the 1918 flu also heavily impacted the 20 to 40-year-old category. Keeping in mind the fact that most military troops were young men, this is not surprising. So how did the medical community react? At the time, there was little recourse to treat the disease other than supportive care. According to Bootsma and Ferguson in the U.S., quote, a range of interventions was tried, including closure of schools and churches, banning of mass gatherings, mandated mask wearing, case isolation, and disinfection and hygiene measures, end quote. Many cities in the U.S. enacted different levels of preventative measures, and some of those that lifted their successful bans experienced a second peak of cases. Some doctors also tried inoculating their patients, but with no proper understanding of the disease-causing agent, this proved ineffective. Variants of the influenza A strain are still present today, but treatment and diagnostic capabilities have changed dramatically. Flu vaccines are produced every year, and vaccination is recommended for all persons older than 6 months. Antiviral and antibiotic drugs are present on the market, and rapid tests can determine if a patient has been exposed. Supportive care is also still prescribed, with the sick being instructed to stay home and rest. At the time, the impact of the pandemic was mostly overlooked due to the ongoing war, even though the death toll of the disease was higher than the war. While the 1918 flu faded out of the public mind shortly after its last case, it has been the object of much study since. Given the unique virulence of the 1918 strain of influenza A, experts around the world have wondered if there is a possibility of another severe outbreak of a similar scale and suspect that it's likely. As such, there has been increased monitoring of influenza along with stockpiling supplies against their future pandemic and government planning. That concludes our discussion of the 1918 flu. Thank you for listening, and remember to get your yearly flu shot and stay healthy, everyone.